In this video, I'm going to show you a hamstring stretch that's both easy and safe. Stay tuned. Finding a good hamstring stretch either on YouTube or somewhere on the internet can be a little difficult because there's a lot of different variations that you can find. Some will influence not just the hamstring, but other parts of the body, like the low back and the pelvis and that sort of thing. So we're going to try to go through the weeds with some of those really quick. Then I'm going to show you a hamstring stretch that purely isolates the hamstring that I show to a lot of my patients. So some people will utilize a hamstring stretch that's pretty easy, and most people have done it where they stand in one spot and they bend over and they try to reach their toes or their ankles. So this isn't bad. You can feel a little bit of a pull, but the problem with this is two things. Number one, as you stand there, you have to fire your quads, your hamstrings, your hips, that sort of thing, just to stay upright. So if you bend over, you're going to feel a little bit of a pull and a little bit of a stretch, but you're trying to stretch an already kind of contracted muscle, so you're not going to get very far with that. Plus, gravity is helping you. You're flexing the lumbar spine, and if you have any pain in the pelvis or the low back, you can find that to be a little problematic and kind of painful. So now if we do another one that's going to be very similar, where we're seated, similar position, we're not utilizing gravity, but we're leaning forward, trying to touch the toes, try to touch the ankles. Sure, we're relaxed, we can feel a little bit more of a pull, but at the same time, again, we're trying to not influence the low back. We see there's a lot of flexion with that. It doesn't purely isolate the hamstring. So then other people will say like, oh, well, what if I just lay on the floor, I put my leg up in the door frame, and I can feel a good stretch. And I think that's good. It can isolate that hamstring for sure, but the problem is if you have pain, it's gonna be really difficult to ask you to get on the floor, maneuver around, and especially it's not very accessible because you're not gonna do that in a public place. You're probably not gonna get on the dirty floor at work. So it's just not very friendly to do that. And then some people will say like, oh, well, what if I lay down, I can take a strap and I can pull back and I can get a good hamstring stretch there. And I think that's absolutely fantastic, but there's two limitations with that. Number one, like you're laying down somewhere, so you're probably not gonna do that in the middle of your day, and you have to have a strap with it. So it can be great, but you have to have two of those things. So I'm gonna go through a really easy stretch that I prescribe to a lot of my patients that makes it really, really accessible to do. It's really easy, and you don't look like an idiot when you're doing it. When I show my patients this stretch, the one thing that I normally try to tell them is to try to find a chair or a stool, something maybe this high. This particular bench is about knee high for me. Most of the time you don't have to go any higher than that. So what I'll tell them to do is to isolate the hamstring, is to put their foot up on this bench or a chair, something like that. And there's a few things that we're gonna do. Number one, we're gonna try to bring the toe up just a little bit. We don't wanna go too high because if you have a lot of nerve tension, that can pull on that a little bit more. That's something that we can play with, but try to bring the toe up just a little bit. Number two, lock that knee down straight. Because if the knee is bent, we're not really gonna get a full hamstring stretch with that. But the second one, a lot of people will be like, oh yeah, I know what to do, and they lean over like this. The problem with that is the same as the other stretches that I kind of talked about. We just have that forward flexion of that lumbar spine, and we really don't wanna do that. And again, we wanna isolate the hamstring. Hamstring connects to the lower part of the pelvis, that ischial tuberosity, we call it, it's the butt bone. So if we can try to isolate that and keep that in place, we just get a pure hamstring stretch. So with this, bring the toe up a little bit, lock that knee down, but we're gonna keep the upper body and the torso straight. We're just gonna hinge from the hip and just lean forward a little bit like that. So a lot of people will do that, but then they'll also flex the back. Try not to do that. Try to keep that straight as you can and just lean forward, and you can feel that pull a little bit. So now, if you can already master that, there's a few things that you can do that's gonna help tweak this a little bit. And it's gonna be everything to do with the pelvis. So you can get in this position, and if you can move your pelvis left and right, you're gonna find that it's gonna pull on different parts of the hamstring. So, and again, I think that's extra credit and maybe a little bit more of an advanced technique, but the more that you do this, you're gonna kind of feel that a little bit better. So one thing that I'm gonna show you really quick is sometimes people have like an inside of the hamstring sort of problem. I'll show you on my left side. So we kind of do the same sort of position like this. We bring that toe up a little bit, we lock that knee down, and we're gonna lean with the chest again. But now, if we feel it a little bit more on that inside of the hamstring, I'm gonna take my pelvis and I'm gonna rock it out to the outside a little bit. So it's gonna be on my right side. So we're in this position and we're just gonna rock it to my right just a little bit, and sometimes we can feel that pull. So like my previous point, just kind of moving the pelvis around a little bit, that's something you're gonna feel, and you might find a little bit more benefit and with just isolating that. If a patient were to ask me how long do you hold these stretches for, I usually say 20 to 30 seconds per repetition. If they were to ask me how many repetitions do they do, I would say do 1 repetition once an hour throughout the day. You don't have to wake up in the middle of the night to do these stretches, but the thing is that there's gotta be things that you do during the day that seem to make this tissue tighter. So it makes sense to stretch it throughout the day as you're also kind of making it tighter. People will challenge me on this and they'll say, well, hey, doc, I probably stretch 20 minutes every single day, which is great. But the thing is that if you have this 20-minute chunk of time that you're working on stretching, but you do nothing but make things worse and tight for the other 23 hours and 40 minutes throughout the rest of the day, you're not really gonna make much difference. So if you do things during the day that make it tight, it makes sense to do things during the day that also chop away at it, that you can continue stretching. And again, 20 to 30 seconds at a time, once an hour would be fantastic. And that, my friends, is a hamstring stretch that I prescribe to a lot of my patients. Again, it isolates that hamstring without putting a lot of tension and pressure on the low back and pelvis. I don't believe that this stretch will totally cure everyone's low back pain, because that's something that's a little bit multifaceted. There's a lot of moving parts to that, but this is something that you can try that can probably help out quite a bit. And as you can tell, it's very accessible. You can kind of do it anywhere. You don't look like a goon while you do it. So I think that could be something that you could be really successful with. But thank you for watching. Please stick around. I have more videos you can take a look at. Please subscribe, and I'll see you guys in the next video.